My name is Shontay Lundy, and I'm the creator and founder of Black Girl Sunscreen. I mean, the biggest one is that, uh, because we have melanated skin, we don't need sunscreen. You know what I will say though, Marie, is I said a number that 7% of Americans don't wear sunscreen, okay? So I'm coming across non-Black people, non-people of color, maybe from Jersey, from the East Coast, and they actually like to be brown and tan, and they say we don't burn. So I don't mean to take this away from Black and brown people, but I do believe that there is a misconception amongst many people that because if they haven't burned, then they won't burn. So it is because of their life experience and what their desire aesthetics is. So with that, Black people, we have a deeper complexion. We don't know that our skin has burned until later. And I'm talking about we're past the burn stage, we're past aloe stage, right? We're now peeling. And the question is like, why am I peeling? Like, what happened? Do I have a rash or what has happened? And you have to put two and two together. Maybe you were, I don't know, running errands. That's kind of like the everyday thing. But maybe you were on a cruise. Maybe you were on vacation. Maybe you were doing all these kind of like sun activities and you had your skin exposed and you just didn't know. So that's the number one misconception is that because you have melanated skin or skin of with some pigments that you don't need sunscreen. Number two is that our ancestors have survived many years without having to wear sunscreen. When I travel, I'm a world traveler, so I go to, I don't know, let's say Southeast Asia or, some island in the middle of the ocean. And how they're protecting themselves is not by wearing sunscreen. They're wearing maybe like a long shirt, long pants with the shorts, right? To keep themselves cool, but also not from burning. When you go to Asian countries, they have an umbrella, they have protective clothing. So I think that people are just not going in the sun as much. And if they are used to a certain behavior, so they don't get sunburned or exposed to these other things, like that's a reason of why they're not wearing sunscreen, but also because, um, listen, this is how my culture and this is how my people have been doing it. Why change it now? Right? So like why stop wearing, I don't know, the hat, the full brim, why stop wearing the long sleeves? Why stop doing these things if this is how we've been providing all of these years? So that's number two, right? Like our ancestors of many cultures have done it this way, so I'm not changing it. Number three, the only benefit that some people see that sunscreen offers is the prevention of cancer. Now, on a cosmetic side, we all know that there's benefits that may delay anti-aging in terms of skin. The benefit of evening out complexion, right? People aren't talking about that as much. That's not the call out on a sunscreen product, right? So folks aren't going into it or um, founders and sunscreen owners aren't going into sunscreen as a solution-based product. They're going into it as, yep, you won't get sunburned, right? So there are many reasons and misconceptions of the why nots. I just gave three. It just starts with representation. And I think it's actually harder or easier said than done. So, if Black people are participating in clinical research, testing, that would definitely be helpful. Now we're starting to see diversity and inclusion in marketing, which actually I have a lot to say about that. But we won't go there because, well, we will go there. So when I say representation matters and being including in marketing materials and seeing yourself reflected in many things, and it's not just about color, but it's about gender, it's about, age, it's about lifestyle. It makes a huge difference because if, I'm a person that kind of just gardens, and that's just like what I do versus someone that, is let's say laying out in the sun. That's two different mentalities, right? So how are we getting all people to be seen in a way that makes them think like, okay, this is something that I should be incorporating into my daily life. So when it comes to representation, right, how are derms thinking about it? How are healthcare providers thinking about what representation means? That would be my question for them, right? Because it's across the board. And when I say brown people, I'm talking about non-black people. So I'm thinking of like Afro-Latinas. I'm thinking about Latinos, Latinas. I'm thinking about Middle Easterners. I'm thinking about anyone that has pigmented skin. So it's not just black people. All people should just be represented. So I think that's how like the derm community could work with organizations like mine, but I think there also has to be a desire. And I'm not sure if the desire is honestly there. I'm seeing it's a really interesting world, Marie, and this might be controversial, okay? But I'm gonna say it. What I'm seeing right now is derms, go through all the training and the schooling and that's great and they learn and then they come and they work for a practice or they start their own practice and then they start making their own products and it becomes this entrepreneur spirit, but then also they have the technical and education, and it's just like they want to do their own thing, so they focus on what they want as opposed to saying like, hey, you know what? There's a community out here that needs this education. I just think it's conflicting. Like folks, people in derm right now, they just have different objectives. And I don't know if it's to truly treat patients for all the skin conditions that are out there. So besides sunscreen, right? There's so many things that can be treated from a derm, but because of the world that we live in, Marie, it's more about the entrepreneurship, the brand deals, the creators, the influencers. So I think that in the derm world, some have just lost the way. Dermatologists and estheticians are instrumental in this journey, right? You know, I would say estheticians probably the first line of defense before derm because clients are able to get into an esthetician quicker than a derm, but also an esthetician may be more affordable than a derm. And I say that because if you're going just for like a facial or some type of, skin treatment, let's call it a couple $100, right? Whereas some practices, they only accept insurance, right? And also patients don't go to the derm unless there's something like, I mean, like emergency, their whole face breaks out, or maybe they have a mole that's unexplainable, or their hair is thinning, right? Because derms treat across the gamut. And what I'm seeing in my world as I talk to different people across the world is patient or people aren't going to the derm until like the age of almost 30 years old. So that's why I say that derms and estheticians are so crucial to the conversation because once somebody is seen by a derm, then they'll typically follow through with the recommendations and the treatment. So everybody needs to hold hands when it comes to the conversation of sun safety, sunscreen, and how to use it properly. So that's something that I'm not sure if everybody is talking about. I'm not sure if even just healthcare, like how do we get more people to go in for, annual skin checks? They don't think they need it, but like you don't really know, but let's just make it part of us being healthy and creating like longer longevity for our lives, right? Like that should be the conversation. So I just think that it's something that folks should really be thinking about is the importance of skin health. And forget about whatever the brand story is. And if you think it's gimmicky, it's bigger than a marketing story. Like your skin health is extremely important to your life.